Angina pectoris is chest pain due to ischemia, lack of blood to the myocardium, the heart muscle in the actual heart, the wall, muscle wall. This is often secondary to coronary artery narrowing or a spasm of the coronary artery, so lack of blood flow getting back to the heart. There are three different types. Stable is the most common. This is often due to atherosclerosis, or essentially the lack of space in the coronary artery. You'll see the classic pain on exertion, better with rest. Vasospastic occurs at rest, and this is due to spasms of the coronary artery, not um, less space in general. And then there's unstable. This often includes a thrombosis, but there's not complete occlusion, it's incomplete occlusion. And in these patients, you can see pain at rest or with minimal exertion, and pain doesn't improve with rest like we see with stable. There's an imbalance in this condition between myocardial, so heart muscle, oxygen supply, and its need. In stable angina, a plaque that is fixed narrows the coronary artery's lumen space. Therefore, there's less blood flow getting to the heart. And this especially is worse during increased demand, like exertion. Therefore, you see transient times of ischemia or loss of blood or loss of oxygen, and then the chest pain resolves with either rest or with nitrates, which makes the blood vessel vasodilate. In vasospastic, the coronary artery spasms, it does not need a plaque to cause this. This leads to just a transient reduction in blood flow, and that's how you could see ischemia at rest. And then unstable, this is a vulnerable plaque that's ruptured. There's platelet aggregation, there's a partial thrombus. There is really significant, but not full occlusion, and therefore you see ischemia at rest or with just barely any exertion. Now, in all three types, the ischemia is transient. There's no actual heart muscle cell death. There's no troponin elevation. So that's a key factor. You can compare and contrast here. I think this table is a great comparison piece, talking about some of the triggers and talking about some of the EKG changes you could see. Stable, you would see none. Vasospastic, a transient elevation in the ST component, and unstable, either ST depression or T wave inversion. All of the classic risk factors, and a lot of them have the same triggers. Vasospastic has some different triggers in cocaine, alcohol, and triptan medication. We'll come back to chronic ischemic heart disease.